There's always we'll get started in a few more minutes. We'll just wait for everyone to end lunch. Hey everyone, we'll get started in maybe one more minute. Still hear a few people in the hallway, so we'll see. I'll just All right, we'll go ahead and get started. Hi, everyone. Welcome to our session today. My name is Erin Palomares. I manage the Global Handwashing Partnership. For those of you who haven't heard of us before, we are a public-private partnership. We serve as a global advocate and knowledge hub for hand hygiene programming. And we have over 40 partners around the world, many of whom are in this room today. But today's session will focus on this topic, hand hygiene within reach. How do we achieve universal hand hygiene? And I know that that's a very broad question, but really we're trying to look at this from a systems perspective. So we'll be exploring hand hygiene systems for health and how different roles and responsibilities can affect the enabling environment across different settings, and of course trying to tie in to some of the other system strengthening sessions that have happened throughout the week as well. So the outputs of the session will directly feed into the ongoing work that's being led by WHO and UNICEF to develop global guidelines for hand hygiene community settings. And more on that will be presented later on in the session. But first, I just want to give a quick scene setting welcome, just to clarify how all this work is being tied together, especially for those of you who haven't heard of the global guidelines process or haven't been involved in any previous discussions. So we facilitated a few key stakeholder meetings in the past around these guidelines and really the uptake strategy for these guidelines. Last year, we hosted a hand hygiene think tank where we worked with partners across different contexts to map out different stakeholders. We then followed that up with a few UNC sessions last year, presenting some preliminary findings from that event. Then we also hosted a session at IRC's All Systems Connect in May, where we looked at roles and responsibilities more broadly. But those discussions have all really led us to today, where we know that these guidelines require a system strengthening approach for implementation, but we also know that that requires us to look at, what the system looks like in these different contexts. And of course, that's very different. So I just want to go over today's agenda. So we knew we needed the right person to chair this session for this discussion, and Ellen is the perfect fit for that. I'll pass it to her right after this, but she'll start off with some opening remarks. Then Betsy from WHO will give some background on the guidelines process and set us up for the panel discussion. Then we will have a panel who will look into how roles and responsibilities vary by different settings. And then we'll go into plenary, where we'll hone in more specifically on the role of government, because we know that the government is really the driver for these guidelines and hold ultimate responsibility. And then finally, we'll have some closing remarks from Lisa Raj from FCDO, who will sort of tie all of this together and also tie into the session from yesterday at Redbud if you were there and just trying to tie in all these system strengthening discussions in one pretty bow. But with that, I'd like to introduce our chair for the session, Ellen Walter, who is part of IRC's Advocacy and Partnerships team. She has lots of experience around hygiene system strengthening and will help guide us through this discussion.
Well, hi, everyone. Good afternoon. Let's try that one more time. Good afternoon, everyone. Oh, much better. I am happy to see you all and happy to be here today to do this. I know that sessions right after lunch are always very difficult. So if we need at some point, I'm going to have you guys like get up and do a dance or jump around or do something fun to make sure that we still have your attention through our hour and a half that we have together today. So I'm Ellen Walter. I work for IRC. I'm based in the US and I come from a background in public health. And so this is very much with my advocacy and partnerships hats, as well as my background in public health. This is very much my sweet spot. And so I'm happy to join you guys today as your moderator. So a bit of background here. That's me. No, that's not me. But they're more adorable than me, which is why my face isn't up there. You can see it here. The WASH system is made up, it's a very complex network. You've probably heard this in other sessions. It's a web of actors and factors, actors being people like policymakers, service providers, service authorities, lots and lots of different actors, and these factors. So is there reliable information? So things like monitoring systems for decision making. Do people have the willingness to pay? Is there institutional capacity of either regulators or the different other government actors to really take the lead in making service delivery and influencing the way service delivery happens. So it's this complex network and web, but it's the interaction between those. Today, we're really going to focus on that who, the actor side of things. But WASH systems sit alongside other systems such as health and education and sit within a very large political economy within a country. And so we're taking a very small piece of what is something that is much, much, much larger. And so as Erin said, this discussion is really supposed to feed into this kind of guideline development process that's underway. So at this point, I want to turn over to Betsy Engelbretson from WHO, who's going to walk us through kind of this overview, and then we'll go from there. So Betsy, over to you.
Thanks so much, Ellen, and thank you all for coming to our session this afternoon. As Ellen said, after lunch is always a little bit tough, so hopefully I'll make the guideline development process as exciting as possible for you all. And so, yes, as Ellen said, I'm Betsy. I work for the WHO. I generally work on glass, so monitoring WASH system strengthening, but I'm here supporting colleagues who couldn't be here. So if you ask me hard questions, I'm probably going to dodge them. So this session today, I'm going to talk about two main things. It's going to be about the guideline development process, and then a little bit about how we think about systems and the rules and responsibilities within systems, which our panel will be discussing, and then that we're going to be drawing upon you to get your ideas for this. I'm going to stop there. There, Oh, so here's the upcoming, so now about what the guidelines are. First of all, do we even need guidelines? I think most people think, oh, washing hands, pretty simple. Why aren't people doing it? But there's actually there is a huge space for the need of guidelines. A paper was published that looked at a scoping of what had been done in the hand hygiene space. There are a lot of inconsistencies and discordance. When, with what, and how. And that's more of like the scientific part. I'm not going to get into how much water you need or what type of soap is best. But then there are also gaps. What is the most effective behavior change? What are the recommendations on system strengthening? That was basically non-existent. And we know that hand hygiene isn't being taken up as enough and governments are struggling to provide it. So what are we doing about system strengthening? And then this is kind of a critical part. They were lacking in evidence. Less than 10% of the recommendations were evidence-based. So there is definitely a need for guidelines in community settings for hand hygiene. So a quick overview about what the guidelines are going to cover. First of all, the settings. You might have noticed we have not mentioned healthcare once because guidelines for healthcare facilities already exist. So this is really focused on community settings, which has kind of fallen through the cracks. So we're looking at anything non-healthcare, households, public spaces, institutional wash. Who are we targeting for these? The target audience is really the Ministry of Health. There's been a lot of discussions about it, and the Ministry of Health often has the mandate for promoting hand hygiene in countries. That being said, if in the country it's not the Ministry of Health, these guidelines can be taken up by anyone who has the mandate for hand hygiene. And then the content, there's 3 sections of this. There's the what, that's the more the scientific, what are your minimum schoolable standards for things. There's the how, that's what we're talking about today. How do we use these systems? What are the key parts of the systems? Who's involved to actually make sure what is written in these guidelines trickles down to people actually practicing good hand hygiene. And then finally, a crucial part of these guidelines will be the roadmap. And that'll be step-by-step guidance for how governments can actually put the guidelines into practice. We aren't there yet because we're still developing the guidelines themselves. All right, so now looking at the how, this is the system strengthening content part of the guidelines. What is this section of the guidelines going to cover? It's going to cover the different functions. It's going to cover the institutions, actors, roles, and responsibilities. It's going to cover variability across settings, and that's what we're here to talk about today. Because as you know, hand hygiene in households might look very different than hand hygiene in a shopping mall or hand hygiene in schools. So we're talking about variability across settings. We'll also talk about government. The guidelines will also talk about government planning, integrated delivery of system strengthening plans, and then also the leadership role of the health sector. So the guideline development process. WHO specializes in norms and standards, and it has a very rigorous guideline development process. We are not people on our own just making this up and putting it out there. It is a very participatory, rigorous process. And so this part I'm talking about is the actual system strengthening part of it. And so we're looking at demand driven, it is evidence-based, and it is user-centered. And there's 3 main activities that we're doing with this. We have a literature review. So we've commissioned a partner to do an academic partner to do a systematic review and looking at all the system strengthening wash sort of evidence about out there. I will get more into that. We're looking at national data. What are countries already doing to support hand hygiene systems in their countries? And then we're also looking at end user perspectives. And this is consultation processes with people like you, with governments, and all sorts of a range of actors in various ways that we're doing that. So the sort of a timeline for the how, and this isn't covering everything, but just some of the main points. And you can see that this has been a process that we've been thinking about for a long time. So it started in July 2022, where the questions for guidelines were finalized. I should say thinking about this started much before July 2022. That was when we started finalizing those questions. We put out the tender for academic research partner. We had a meeting at The Hague, which I'll talk about more last May. We published we proposed our research protocol. So we stated to the world what we're doing. And then we have plans in the future to share the research with the guideline development group. And then the guidelines are going to be published in December of 2024, if everything goes according to plan, but I'm sure it will. All right, so our literature review, what are we asking our academic partners to look at? Well, the first question was what constitutes effective hand hygiene and what are the minimum requirements for its practice in community settings? What behavior change approaches are conducive to sustain adoption of effective hand hygiene practice in community sessions? And then finally, what government measures can support sustained practice of effective hand hygiene in community settings? And that third question is really what we're talking about today. And then national data, we are drawing upon 2 main data sources. We have the GLASS report, which is the Global Analysis and Assessment of Sanitation and Drinking Water, which is what I work on, and it looks at wash systems data and covering water, sanitation, and hand hygiene. If you're interested in that, I'm going to do a shameless plug. We have a session tomorrow morning at 8:30 all about GLASS data, and I can talk to you for an hour and a half about it tomorrow. Then we also have the Hand Hygiene Acceleration Framework tool, which UNICEF, WHO, and WaterAid have all worked on, which probably other partners. Sorry if I forgot anyone. And it is a country self-assessment of looking at the systems that governments have in place for hand hygiene. You can Google it, there's a dashboard of it. It's very similar to what is in glass, but much more detailed on the hand hygiene system. And then, oh, sorry. Then finally, it's the end user consultation part. And I mentioned we had an official meeting with ministries of health in The Hague, as well as with development partners. And the cool thing about it was that we came to a consensus, and soon we'll be publishing a article with over 40 authors that came to these consensus points. I'm not going to read them all. You can tell I'm losing my voice. I've talked a lot this week. But I think the most important part from this is to building sustainable and resilient national health systems. So there became a global consensus, or there became a consensus that was important for the hand hygiene guidelines, and also that health leadership is important for this. So here are our next steps of where we're going. I started with October 2023, where we are in this room. Thank you all for coming and participating in this session. And then you can see that we'll have various other sessions going on, and there's parallel processes. So there's these consultations with specific settings, stakeholder groups, consultations with wider people at large. And then there's also this co-design system strengthening guidance with a group of 10 ministries of health. And we've identified where we'll be identifying 10 Ministry of Health champions. We'll be working side by side with them on developing this roadmap for hand hygiene. And then again, the guidelines will be in December 2024. So my colleagues will have a very busy year ahead of them of seeking input, and then synthesizing it all into the global guidelines. So now that you have all learned about how we're developing these guidelines, let's get to the more interesting part of this session and looking at roles and responsibilities within different settings for hand hygiene. And so, first of all, what is a hand hygiene system? You've all been to enough sessions that I'm sure you realize that everyone has a different definition of what a system is. I'm not going to read that definition to save my voice, but you can see that we had the main parts were sector functions, institution, actors, and interactions. My colleague put together what a system could look like, and this is what she came up with. I'm not saying this is right or wrong, but it shows the complexity of everything. So if you want sustainable hand hygiene for all, first of all, you need the demand, so the motivation. You need access to water, you need access to soap, and then to get that, you have the customer services, public services, infrastructure, and then you have the different actors playing different roles at various levels. And then at the top, you'll see the SWA building blocks, which we could have stolen any organization's building blocks, but these were SWAs. And it looks at what government could be doing to help support all of the rest of the system. And then again, highlighting more of the institutions, actors, roles, and responsibilities, and just showing how complex it is. You have different levels, you have different mandates in different countries for different settings. You have the national government doing things, you have local government, you have communities, you have individuals. So this is just kind of showing how complex the actors are and how rich hopefully this discussion will be, because there will be a lot of things to unpack in the panel and within the plenary discussion. And then in doing work for this, we found this interesting table about looking at different settings, actors, roles, and responsibilities across different subsectors of WASH. So we have water supply, urban, rural, sanitation, and then domestic. And you can see here, it's domestic. SA is service authorities, MBFP is market-based service provider, households is HH. And then you can see that for hand hygiene, is very much looked at as a personal responsibility. But is that actually the case? Like that's something to unpack later. And then what would this look like in other settings? And so not to get totally ahead of ourselves, but the panel will be touching on this, and then we will also be touching on this in the plenary discussion, is what would these roles and responsibilities look like for schools, for workplaces, for prisons, for transport hubs, shopping areas, plazas, and squares. So there's similarities across all of these, but there's different nuances. Who has the power? Who has the decision-making authority? Who has the mandate in these different sessions? So that is what we will be getting to now, but I'm going to turn it over back to Ellen. Thank you.
So just really quickly, any clarifying questions for Betsy? We can take maybe one or two. Yes.
I was just curious, which sparks the guidelines? Was there one event or a series of events?
Is there one or two more, or you want me to?
Is there?
Yeah. More?
No. Check on one and two. Yes, I will. There's some things in the chat, so we'll come back.
Oh,
to
yeah.
it.
That is a very good question. I don't know if there was one specific event that sparked the development of like the need for guidelines, but I think overall COVID, and initially COVID, when everything like early March, April 2020, hand hygiene really rose in prominence because we didn't know what was going on in the world, and it was a thing, and we realized that how little there had been. And then if you were trying to like provide, like local governments were asking what should we be doing in these different settings and things, and there wasn't like a go-to document. There was research. I know there was the hand hygiene behavior hub that was like really successful in connecting answers, but there wasn't like a definitive document like WHO has its drinking water quality guidelines that have guidelines for sanitation and health. And so I think we realized that there was just kind of a gap in like the normative guidance that WHO had given. If anyone else has anything else to add about how it came about, but I think that was my guess on what sparked it.
Great.
Miriam.
Just because we have wonderful people who are online, so thank you so much for those joining online. I'm just checking the chat, 1 second. Great. So not
There weren't any questions.
there weren't any questions in the chat, but thank you for those joining online. So thank you, Betsy. Let's give her another round of applause. All right, so right now I'd like to invite our panel to come forward. Yes. So we're going to talk about roles and responsibilities by setting. And so here we've got, and I just want to make sure that I've got everyone with their right setting. And to clarify, many of our panelists work in multiple settings, but they're here representing a specific setting in this context. And they're going to introduce themselves. And so Swati is here representing schools. We have Claire on the end representing households. Om is representing public spaces, and Victoria is representing points of entry or transportation hubs. And so I'm going to start here with Victoria, if you just want to introduce yourself. And as you do that, if you could tell us a little bit about, you've worked in multiple community settings, but for this discussion, we want to focus on these 4 settings. And so if you could talk a little bit about how your organization, how CDC works with and contributes to hand hygiene system strengthening within this particular setting.
Sure. Hi. Is that working?
No, it is not.
Did I just turn it on? Okay. The red light means off. I'm not a very good projector. Hey, is that better? Okay, great. So hi, my name is Victoria Trinice. I'm a health scientist with the CDC, U.S. Centers for Disease Control and Prevention. We have been, so my background has been supporting WASH in mostly in institutional settings in schools and healthcare facilities. But since the start of COVID, our team pivoted to supporting hand hygiene in community gathering settings. So places in the community, like markets and points of entry, and also schools and places like that, but those places that are often not served.
Great.
Is that just the introduction?
Yeah, so that's great for an introduction, and we're going to move on. Oh, you're next.
So, hi everyone, good afternoon. My name is Dr. Om Gautam. I work for WaterAid in International Program Department. I support WaterAid country programs, building capacity, supporting from nomadic guidance, and also I was responsible for leading the WaterAid in response to COVID-19. My background are public health. I'm a behavior scientist and public health.
Great, and don't forget, you want to hold that microphone. Unfortunately, we need to eat the microphone a little bit in order to make sure everyone in the back can hear. So go ahead.
Okay, so am I audible to everyone? Yes. Okay, great. So hi everyone, I'm Swati Agnihotri, and I'm a development professional specifically in the WASH sector. And currently I'm working with World Vision for the Washing Schools program in partnership with Sesame and Stanford University. And yeah, I mean, in WASH, World Vision has been working in almost all of the countries, and Washing Schools is a part of our business plan in all the countries. So yeah, we dedicate a special section to WASH. And we are working with the WASH Up. It's a special targeted behavior change program, specifically in schools. And it's being run in 15 countries, including India as well. So yeah, that's about it. Thank you.
Good afternoon. My name is Claire Chase and I work with the water practice of the World Bank. My background is in health actually, and I started at the World Bank in 2008 on some Bill and Melinda Gates Foundation funded research of scaling up hygiene, hand washing in Vietnam, Peru, Tanzania, and Senegal. Impact evaluations, which kind of blew open the world of hand hygiene, I think, in terms of the results that we found from those studies. A lot of reasons for that. But so since then have worked on many of our operations around the globe that incorporate hand hygiene and have been very much involved with the Global Hand Washing Partnership over those years.
Great. At this point, you're, again, each of you is representing kind of a different context. And as Betsy noted in her presentation, that the guidelines are going to focus on these different contexts in the community. And so can you describe who are those actors within each of your contexts that are essential? I'm curious to hear, some of them will have overlapping types of actors, and some of them I think will be very unique to your setting. And so if you can just describe, and we're going to start kind of down at the other end and work our way backwards, but just describe who some of those actors are.
Yeah, so I am speaking on behalf of households today. Yeah, so I think when I first got this question, as many of you would probably, first reaction is, of course, it's the household's responsibility to ensure hand hygiene. But that's just the tip of the iceberg, right? And so we have to really think about, first of all, let's think about the household. I think over many, many years, the focus at the household level has been on women and really putting a lot of burden on the mother to ensure the hand hygiene. Of course, we know that women and children are often responsible for bringing the water to the household, and then it's the mother who's responsible for the hand hygiene. So I think that's something that we need to also take into consideration and how we design and support these types of programs. And then also households, right? We're not talking about a uniform household. When I initially think of a household, it's sort of a family unit in a village. But we know that there are many different types of household settings. There are group homes that maybe are sharing sanitation facilities where there might be hand washing stations and those facilities. So we also have to think about those different household contexts in terms of who at the household level would be responsible for the hand hygiene. And then, so as I said, the tip of the iceberg, but let's, drill down a bit. It's also the facilitators of that hand hygiene behavior that play an enabling role, right? So if we think about behavior, there's the community motivators that may be supporting behavior change, communication to the households. There's also, we work a lot with conditional cash transfer programs in the World Bank and social workers or motivators that may be engaging with the households that can communicate those messages. Then when we get to the actual supplies, right, the basins that households need to purchase to put together a hand washing station, the water, of course, right? So then you have some engagement and involvement from the private sector that may be providing, maybe selling the soap or the substance that's used for hand washing. And then, of course, there's also the local water service providers that's going to be responsible for ensuring the availability of the water. Let me just end by just to illustrate this concept, a story that I've told many times before, so some of you may have heard this story, but when I was first doing research in Tanzania back in probably 2009, 2010, we were looking at this hand washing impact evaluation. And so we were going to different households trying to test out the survey to do structured observations with hand washing behavior at the household level. So we were visiting this woman's household in rural Tanzania, And we were observing, and she had a bucket there of her water source, and she was using the water in the bucket to wash her dishes. And then her child defecated on the ground. And so she picked up the child, she stopped washing the dishes, picked up the child, put the child into the bucket, washed his bottom, took him out, and then proceeded to wash the dishes. So what does that say? Obviously, you cannot have clean hand hygiene if you don't have a water source, right? So it's that element is so important to really think of the full chain of inputs that need to be in place in order for this practice to be effective.
Great. Go ahead. Yes.
Okay. So in a school setting, I think I would like to start up from the top, like the state education department. I think that's where it starts from, to set the base for the policies and everything to be in place. The allocation of funds, which is really important from the state to the district. And then at the district level, I think the actors are basically the district education department and the district magistrate, who is in charge of the entire district, and the monthly review meetings which happen. Because hand hygiene in school setting is more or less dependent on if so we see a school setting and there are hand washing stations, but many times school lack funds to help maintain it, and so the operation and maintenance of the wash facilities, including the hand washing station, is really necessary. I mean, for children to practice it. I mean, we can have the behavior change program, but if there's no hand washing station, there's no running water in the hand washing station, or there's no soap availability, then it'll be like pretty difficult for children to actually follow that. So the state and the district roles are very important here with respect to laying the policies, monitoring, and allocation of funds. When we come down to the school level, I think there we have the headmaster, the teachers, who need to be trained to have that capacity to, to build their capacities in knowing what's the correct hand hygiene, what are the steps of hand washing, how long do we have to wash the hands, what are the critical times of hand washing for students while they're in a school setting. So all that is important because it's ultimately these children are at the care of the teachers there in the school setting. So it's important for the teachers to have that, capability and the skills to promote that. And yeah, so in the school setting, I think I would wrap up with this, and then how we can discuss further. Yeah,
Great, so thanks.
Thank you very much. WaterAid works in multiple settings when it comes to hand hygiene. We work in school settings, healthcare settings, community settings. But throughout the COVID pandemics, we also felt that hand hygiene are universal. And of course, today we are talking about whether or not we achieve universal hand hygiene. If we are not addressing public places, particularly the informal settlements, the bus stands, the marketplace, if we don't address the hand hygiene need in those public places, what happens? Because people interact with the social environment. And when people move around, those public places can become an epicenter in terms of transmitting disease, because that's where people are gathering. They are not practicing hand washing facilities. But we often feel that those informal public places are not institutionalized. To ensure the universal hand hygiene, one of the building blocks earlier presented was, do we have the right institutional mechanisms where right institution with responsibility can fix the hand washing facilities, can also advocate for the need for regular operation and maintenance of those facilities, can also motivate people to practice hand hygiene when there is a need. Particularly on those informal settlements, when there are no right institutional mechanism, what happens? The institutional setups it sticks without facilities being available. Without facilities, then of course we cannot practice the behavior. We felt that throughout the pandemic, because WaterAid responded COVID-19 in 26 countries, we felt that, well, let's also install hand washing facilities in public locations. So what we found, it is easier to institutionalize hand washing facilities in schools and healthcare facilities, but it's very difficult to institutionalize. When I say institutionalized, meaning ensuring functional hand washing facility with soap and water all the time when necessary in public places, particularly in informal settlements and those public places. So a couple of things being challenged. One, there is no standard facilities, inclusive hand washing technological options that can be placed in different locations. What kind of technological options do we need for informal settlements? If we don't have the technological options, might be very challenging that your facilities may not be conducive or may not be used by the clients. The second, just having facilities is not enough. Handwashing does need a daily operation, need a soap, need a water. Who is going to supply water in a marketplace, in public places, in the junction of the village, if there are no dedicated institutional mechanisms? So finding that right institutional mechanism is quite tricky. So having standards, at the same time, having very responsive institutional mechanism on those key locations is quite vital. We had a very, at the initial of our response, because WaterAid has delivered the handwashing facility in public location in partnership with the local government, but their thinking hasn't been there. Oh, we need handwashing facilities in schools, in healthcare facilities, not in the marketplace, for example. So therefore, after a few months, 2 months, 3 months later, the sustainability of those facilities went down to 23%, 30%. It taught WaterAid as a whole that, oh, we need to focus on now sustaining these facilities. How do you ensure sustainability in those settings? So a couple of things came in. One, who is going to supply the water? Who is going to supply soap? Who is going to be responsible for daily operation and maintenance? Who is going to be then taking care of? Are there any nudges or prompts that we can put in a specific location so that those facilities are being used? We have gone back again, have done we call it the longitudinal monitoring on those facilities. We went back and then try to identify what are the barriers, why people are not using these facilities, and who is responsible. What makes this environment more enabling, and how do you create that enabling environment so that the people who need services can actually use it? Our midterm rapid assessment has shown lots of learning into this. We went back, and now our final evaluation shows that these facilities, 80% of those facilities are actually fully functional. So what we need to ensure, we need to have the standards, the capacity in place, the right institutional mechanism in place to sustain those services. At the same time, the reactive nudges and cues need to be in place so that those facilities are actually being used. For all of these, having a dedicated institutional mechanism with responsibilities is quite key. And often these public locations are not a targeted place for neither to the local government. They often feel that, oh, this is the responsibility of a bus stand, the owner of the bus park, for example. This is the responsibility of let's say, the market owner. There are no dedicated person who owns the entire market, for example. Throughout the COVID pandemic, it has been quite challenging. So our learning has been quite significant in this particular areas of work, that we need a dedicated guideline like this with the right standards. If we are operating anything in the public settings, we need to have a dedicated institutional mechanism. Otherwise, don't install any facilities. That's the e-learning. If there are no dedicated institutions, don't install. We have even moved some of the facilities into close by healthcare settings or schools because there were no one to take care of those facilities later on in the second part of our the response. Third, if we need to operate this, the financing is quite key. From where this financing are coming, neither the Ministry of Health nor the Ministry of Education is actually responsible. Not the Ministry of WASH. They often think that, oh, the financing is going to go for communities. Ministry of Health think that healthcare facilities. Ministry of Education think that is the schools where they want to focus. If the local government is not responsible to operate this, it's quite challenging. So for me, I think operating in public places throughout this COVID pandemic has been a great learning for WaterAid. At the same time, I think we felt that there is a great need to have very institutionalized documentation, guidelines, standards, and mechanism in place to ensure the sustainability of public handwashing facilities.
Victoria, really quick before you go, I just have one follow-up question. So you said very specifically, government does not think it's responsible. So who are the actors specifically that are part of this? You named like the owner of a bus company. You named the owner of the market, but there's not really an owner of the market. Like, is it the responsibility of those that have stands at the market? Like, who would you say are the main players within particularly this context?
Sure. When we went back and started sort of institutionalizing it's from the sustainability point of view. I think a couple of examples. For example, religious place where we have installed the facilities. It was the religious leader of that particular institutions who has more power and veto to sustain those facilities. The second bus stand, I think there are loose networks into the bus stands. If those bus stands colleagues who has a loose network, if we are not making them accountable since the beginning, they're not feeling, oh, this is our facilities, we need to operate and maintain. And local government often think that, oh, there are people who earns money because, for example, if there are private operators who are running services, government felt that, oh, because they are the one getting financing money back from the services, why can't they fix it? But these people who offering the services don't necessarily think the need of hand washing facilities, for example.
Mm-hmm.
So what we have done is basically we went back to the bus park, loose network companies, who is actually operating these, or look, do you feel there is a need for these facilities? The COVID is spreading, you are contaminating many people. Then, of course, in a couple of those, there are success examples. We have installed a couple of facilities in cross-border transit areas as well. The cross-border areas where these big truck drivers is actually crossing the border. So I think it purely depends on who owns those places.
Okay. People who own them.
Own
right?
them.
Okay, so we've crossed over quite a bit into the public transportation side of things, but I'm also going to ask if you've done work in other public spaces, if you have thoughts on who else might be involved in the other types of public spaces. If you want to add that twinkle into yours.
Yeah, so I think uncovered a lot of the challenges that we've seen. So I'm representing transportation hubs and points of entry, and our experience from COVID was supporting work in Uganda and Kenya. So that caveat of that's the area that I know the best. But in transportation hubs, I think that raises an interesting question about there is who we think should have the responsibility versus who thinks that they have the responsibility. And in our programming, same, I think, is we always try to target whoever has the financial management of the institution, but they don't see necessarily that hand hygiene is part of their mandate. If hand hygiene maybe or hand washing stations by toilets, I feel like there is a more logical connection there, and that has kind of historically been supported. But hand hygiene for like people as they get off buses is an entirely new space, and I think that's where the local health departments and local government come in for the enforcement side of things to try to both advocate and to monitor to make sure that the hardware infrastructure is available, especially during outbreak settings. I do want to talk about points of entry, which is a kind of slightly different context because there are different actors in play there. And there are a variety of levels of formality of points of entry. Some are very informal, that people just cross the border. Some are collecting, are checking trucks, but people kind of pass through more freely. Some are very formal points of entry that have good customs and immigration systems and a lot of great infrastructure. And at the larger points of entry, there's usually port health doing some level of health screening. During COVID, port health started appearing even at the more informal points of entry as a way of tracking COVID and other diseases. But and when port health came in and during COVID, hand washing stations were made available for people as they were passing through. And port health was often responsible for the management and oversight of those hand washing stations. But in Kenya in particular, not in Kenya, in Uganda in particular, there was not a plan in place for long-term funding and establishment of these port health offices. And so they borrowed people from local health departments, and those people they are not getting paid extra to serve their port health activities. And so that has fallen apart because the hand hygiene stations came along with these new port health offices. The Revenue Authority, which manages all other infrastructure at points of entry, doesn't see the hand hygiene as something that is theirs because it was part of this port health office that has now gone away. And so I think That's a little bit of transition that we're dealing with now. But in general and going forward and thinking about roles and responsibilities, at points of entry, the revenue authority, people who are collecting the customs, and the people who have the money are responsible for all infrastructure. They're responsible for supplies. They're responsible for that financial side of things. And then the the health ministry or local health offices are kind of responsible for the day-to-day management of hand washing stations and the advocacy and the user demand and that sort of thing. And so there's that tension between those offices that is not always well accepted by either of them.
Great, thanks. So one of the, we'll say, actor groups that was mentioned was suppliers, but it was only mentioned by one of you. And so I'm just curious if you see a role for hand hygiene, either from a promotion perspective or that supply chain in the other settings. So yeah, I don't know who might want to start, but what do you see as the role of and when suppliers could be suppliers of soap, I think was mentioned, but it also could be you know, the whoever is the supplier of water or the whoever might own the water in a particular place, or might be the government that is supplying water in a particular place. So the utility and or whoever else is the supplier of that, as well as the specific, you know, facility to, or the infrastructure alongside that. So
yeah, I mean, I would absolutely agree that provision of water is a key element, I think, probably across all of the settings, because there is no guarantee that your Matatu ticketing office is going to have a water point at it. And if we are asking them to provide hand washing for clients as they come through, there needs to be that access to water, so that we are not overburdening somebody by saying this thing that you already don't think is your mandate. Can you also go walk half an hour and bring buckets of water over to serve this? So I think we absolutely need to have that integration with water supply.
anyone else want to add anything?
Just one addition, I think for all of us here, we want to ensure the universal hand hygiene, right? So our intention is to make sure that these services are in place where needed. But if we see that there is no regular supply of soap and water, installing these facilities in irrespective of any settings is not going to be functional. If we know that, I think without either the company supplying water, for example, the utilities, the authorities, if there are any other source in healthcare settings or in school settings, the alternative options including rainwater harvestings or connecting pipe connections, if those facilities are not available, either we need to make sure that those facilities are available. If not, then how do you make sure that the government feel accountable to offer those services, or institutionalized settings demand for the services? So we need to go both sides. It's not only offering service, but make sure that the service providers feel accountable that, oh, the hand washing facility has to run. Therefore, there is need for water supply. And the soap, I think in particular for soap, throughout the pandemic, it was evident that I think offering one-off the soap is not going to be enough. So therefore, I think there should be a regular mechanism, financing mechanism also, to ensure those soaps are available. Otherwise, it will be just one-off, few months, vertical project implemented, 6 months, these facilities are not functioning. So institutional license since the inception.
Thank you. I think with respect to the school setting, the school and the school headmaster and the teachers have the capacity to, to provide the soaps, provided they have the right amount of funds. Because there is small percentage of funds allocated for wash in schools in India, but it's not, so it's for wash overall, which includes the toilets, which includes, the overall cleaning of the school premises, which includes the hand washing facilities as well. So a dedicated percentage of funds, to be allocated just for hand washing station maintenance, for the supply of soaps. The water supply is majorly taken care of by the water department, which supplies it to the toilets. And so water supply is not an issue majorly. It's just that the soap availability and the functionality of hand washing facilities, which is there. So yeah, the right amount of dedication of funds need to be there, like that bifurcation of funds, that okay, this is for toilets and this much has to be spent on the hand washing station specifically, which is missing. Thank you.
Great. So I have a follow-up question, actually, specifically, you want to pass the mic down, yeah? So one of the things that you were talking about in the beginning, was about the burden falling, significantly on women. And there was a mix of actors that you mentioned, that some are directly related to the household or have a direct interaction with the household, and some that are outside of the household. And so, can you talk a little bit about how you see the interaction with some of the other spaces? So for example, with schools or with public spaces, where those same actors are present in those spaces. So when a mother is not only responsible at the household level, but is also responsible for maybe providing sometimes, whether it be soap in school or goes to the market for that consistency. Could you just talk a little bit about that? So what you see is the overlap of some of those actor groups.
Yeah, although I would turn it a bit on its head, and
Sure.
that I think that those settings also have a very big influence on the household behavior, right? So, and also provide entry points for changing behavior. And this is something that I think we talk about a lot, right? The schools being the mechanism for teaching the children about hand washing behavior, and children can then bring that behavior home to the households to sort of generate the demand at the household level. And we also talk about, certain life opportunities to introduce hand hygiene. For example, when women are pregnant and they start to go to antenatal care visits, that can be an opportunity to communicate about hand washing that can then generate the behavior for longer term practice. And then obviously on the postnatal follow-ups, when a child is when you have an infant and there may be some community motivators that are coming to the household for various purposes, integrating the hand hygiene into those discussions. I think one thing I also just want to emphasize is we often, I've worked with a lot of the social behavior change communication campaigns where we have our wash module where we talk about treating the water, we talk about washing hands, but we're not really, and I know you've done a lot of work on this integration, but really thinking about those moments where you can influence the behavior, right? So if you're talking, if a motivator is going to a household to talk about preparing food for the infant when they get to the age where they're introducing complementary foods, that's when you need to talk about the hand hygiene, right? Not as sort of like a separate independent module. And I think so that integration that you're mentioning, Ellen, I think is so important for having this full enabling environment, that it's so well integrated that unfortunately it's invisible, and that's our big challenge in the wash sector. But ultimately, I think that's where we need to get to.
So I want you, for the audience, to be thinking about your questions as well. I've got one more question for our panel, but so get ready. You're up to bat in just a moment. Speaking of the enabling environment, all of these actors play some kind of role in hand hygiene in the enabling environment. And the system, we heard about a lot of different systems actors in the discussion so far. Do you see, this is slightly provocative, do you see any of them that could play, we'll say they would negatively impact the enabling environment through potential actions that they might be taking, thinking that they're headed in the right direction? So for example, if I'm trying to think of a good example, but I was just trying to think about is there, we think of actors, we want them to be positively influencing the enabling environment, but we've talked about the positive ways that they can influence, but is there the possibility they could be negatively influencing the enabling environment? And one other question that's specifically for Victoria is about when you have these changing situations where you had a really good potential solution with the Port Authority playing this really big role, then they disappear or they're not playing that role anymore. do you think it's possible to get that back? Or do you think it's like looking for alternative solutions to finding different actors that could play that role? So if the negative question is too confusing, then don't answer that. We'll just place on Victoria and we'll go to the audience. But yeah.
Well, I actually think that that was the example that I was thinking of. Like, I think that the Port Health, the Ministry of Health's outpost at the point of entry was doing a good thing by taking on this hand hygiene issue for themselves and being like at the forefront of, we're going to put these in place, we're going to advocate for their usage. But when they didn't have continued funding to be able to keep the Port Health office open, the revenue authority, who should be responsible for that because they're responsible for infrastructure, was like, well, that was your thing. That was not our thing. It was never our thing. And so that built this kind of, from the beginning, they didn't build a consensus approach to how this is going to be maintained and supported in the long term by the entire community of the point of entry. And so it made it easy for that just to be dropped. Yeah.
Great. Does anyone else have anything that they want to add quickly before we open up for some other questions? Yeah.
On the negative side, I think the competing interest among actors. For example, we have seen the rise of hand washing facilities and our hand washing campaign throughout at the beginning of the pandemic, where as soon as you have the vaccines, of course, the government priority shifted. They wanted to buy more vaccines. They want to make sure that logistics, the cold chains are properly appropriate, but their financing for hand hygiene has actually dropped. And despite the fact that they know that it has to go on in hand. So kind of, how do you actually balance that competing priority within the government? So that does require continuous lobbying and advocacy. That's one. The second one, I think the priority settings at the local level. For example, in one of the country that I visited recently, in one of the country, they were trying to make their playground concrete, and they were still demanding for extra funding for toilet and hand washing facilities. And we are asked, so you have the money, why don't you actually build toilet and hand washing facilities instead of making these very lovely grass ground in concrete? And they felt that, because the student need to do more exercise, more additional extracurricular activities rather than the need. So how do you actually make sure that your campaign goes alongside the behavior change campaign, go alongside the service provision? So competing priorities and making sure that we are not only promoting facilities, but also the behavior change at the center.
Yeah, just wanted to highlight one small point that many times I think the states and districts, when they feel that, this is something we need to highlight, and then they say like, okay, it's like 100-day program and we run it for 100 continuous days, and, and see, and everywhere there's super monitoring at the district level, at the school level. And then after the 100 days, it's all gone. So what I want to say is that hand hygiene is special enough to talk about it because it's not happening, it's necessary, but it's not special. It's like a very basic thing. It's like very basic need, which has to be done. So from the government's perspective, I think they should make it on and off. The monitoring should be such that it's not very special, happening on very special days only. Like I see during Global Hand Washing Day, all the schools are running hand washing campaigns and for 10 days, for weeks. And after that, everyone forgets about it. So it's a very basic thing, and that needs to be talked on and off and has to be monitored regularly at the school setting, across all the settings. Yeah.
No? Okay. So we're opening to a much larger discussion. I'm going to ask actually if you guys are okay with staying up for this part of it as well. But what we're going to do is you can ask questions based on the conversations we've had so far around roles and responsibilities, but we also want to talk about, if I can get this to go here, maybe. Oop, one too far, nope. Yes, there we go. So what is the role? Yeah, I think we're great.
You're great.
No, I wrote it down. So we're gonna, but it's only for one person, so I'm gonna ask, we'll make sure it gets answered before the end. So what is the role of the government in each of these settings? So before, when Betsy presented, we were looking at, so we have the different settings: household, schools, workplaces, prisons, transportation hubs, shopping areas, plazas, and squares. And so what is the, around demand creation, the CapEx and CapManX, the OPEX, the O&M, regulation and enforcement and monitoring. So those are some, again, the building blocks, depending on who you ask, there's a variety of building blocks. These are the ones that were, these are some of the kind of building blocks or components of what we're looking at as part of the guidelines. So you can respond to this if you have ideas here, but you can also ask questions to the panel about roles and responsibilities, particularly the government in these particular settings. We heard the government isn't doing something, but maybe it should be their responsibility in a lot of places. We heard that the government is shifting priorities. So yeah, just opening up to folks from the audience. We'll go here, 1, 2, and 3, and then we'll do a second round. So go ahead. Just speak very loudly.
Okay, I will try to.
Yes, and tell us who you are.
David Brandes from CDC, stating my biases, I work on Victoria's Secret, so.
Okay, great.
Not an unbiased actor, but I'm curious about, related to the role of government perhaps, who in your settings should be responsible for the monitoring of hand washing stations? Because the healthcare model is very health focused and has often had an infection prevention control person who is solely responsible for that. So in these settings, is that a role for the government, or who should play that monitoring role of what's present?
Okay. Before you guys answer, we're going to do all 3 questions. So yes, and again, speak loudly and tell us who you are.
I'm Kate Greenland, London School Hygiene. I'm interested in the community setting. When you go to households, you often find, say, at any one time, about a third of them have soap. But when you actually ask the question on how many days in the last week have you had soap, then you might get down to about 13% of those households have soap. So people don't have soap consistently, and it changes across the seasons. So I guess my question is about whose role, responsibility is it for there to be soap available in the households? Is it about changing people's perceptions of the value of soap so that they choose to purchase this item, or is it about changing the type of soap that's available, the size of it, and the cost for it?
Great. Please.
Hi, Krista Cook, Team Rubicon. We work in the disaster, pre and post disaster space, along in the refugee space. And my question is really more around behavior change. Obviously, hand hygiene, you need the infrastructure, but also behavior change. And I was wondering if there's any trauma-informed approach when it comes to promoting hand hygiene in these environments.
Okay. So maybe we can start with the soap and household. Claire, if you want to start and answer that one, and then we'll come back to the other questions.
Yeah, so I think the question on monitoring, I think is that is a really tricky one, because I mean, in many countries, you cannot imagine the government coming into your house and checking if you have a hand washing station with soap, right? But that's what we do. We have a very big program which we support in Vietnam and other countries as well, but that program is a results-based support. So it requires the community to demonstrate that over 80% of the households or 85% of the households have a hand washing station with soap available. And they actually go around to the households and check a random sample to see that they meet that target. So and it's only done once to get the disbursement, the loan disbursements to get the incentive. But how realistic is that for, outside of Vietnam, where you have much more access to, government has much more access to the household level? It's unclear whether there's, it's appropriate for government to actually be checking in households. So I think it's perhaps more a question of ensuring the enabling environment, which I think gets to the second question about the availability and actually seeing the soap in the household, right? So the enabling environment for the products at the household level, which I mean, from what we've seen, it does have a lot to do with the, firstly, the availability, that it's accessible within sort of a market setting in that community or in that localized area where the household can purchase the soap. It also has to be affordable. It needs to be, I think we learned just during the lunch break how in many countries, bar soap is only used for washing the body. It's not used for hand washing, right? So what is the acceptability of different types of soap? And is it available in quantities that are affordable and that a household is going to continue to purchase? So all of those sort of questions about the enabling environment, which frankly, I think we've seen a lot of private sector has taken that market, right? And they've had no problem with other consumables. So it's probably just about making sure there's accessibility for the private sector to operate in those locations. But yeah, much more to say on that, which I'm sure my colleagues can add.
Right, maybe, Swati, do you want to go next, about just the monitoring side of things?
Yeah, sure. So in the school setting, I think the monitoring has to be done basically from the school sanitation committee, which is there at the school level, for just, the availability of soap and water at the hand washing stations, the maintenance of the hand washing stations, supported by the district officials and the state officials, because anything which comes from the top, which is being monitored, and the headmaster knows that this is being monitored, has a different impact altogether than which they know they don't have to report anything after 2. So if my superior is asking me anything regularly, then I'll be up on my toes and, working on it and reporting on it and seeing if that is maintained. If there's no reporting from a level above, then, the person might be, careless about it and not regularly see through. So I think the monitoring has to be from all the levels, state, district, and at the school level, it has to be the headmaster, supported by the school sanitation committee.
From the monitoring point of view, one of my experience from one of our countries where we have implemented nationwide hygiene integration, I think establishing any, of course, longitudinal monitoring for any facilities is quite important, so that you can rectify anything necessary to maintain or operate. But at the same time, if you create other vertical mechanism other than the government institutionalized mechanism, is very difficult, and it costs money. It will be destroyed. So therefore, I think whether integrating into existing health management information system, SMIS, health government Ministry of Health systems, or any national MIS systems, at least making sure that the responsible institutions accountable to send the data either on a 6-monthly basis or annual basis would be ideal. And we have established that part of our the health management system in one of the country, where we integrated hygiene into nationwide vaccination campaign, and all of the health institution, local institution has to report whether their facilities are actually being functional. So having within the system actually make the local institution accountable. Oh, we need to report. So therefore, we need to ensure that there is a soap, there is a water. So mechanism would actually help for the functionality. But then for the public places, I think we need to have the at least longitudinal monitoring, because in public places, operation and maintenance are often regular operation and maintenance are often difficult. So we need to have at least the supportive supervision mechanism, and also maybe institutionalized local monitoring rather than point specific monitoring.
I will only add that I think that there's both the formal monitoring for the government to know what's going on, and then there, I think, needs to be some level of informal monitoring of wash systems to make sure they're operational and functional, and that should be the responsibility of the organization or the institution or location that is managing the hand washing station. But I think the larger question of government monitoring is something we've talked about in the past. Is really difficult because there's no regular points of contact with a lot of these locations with truck stops and places like that. Like, it would be creating an entirely new monitoring system that seems like a steep ask. And then I just wanted to say that I unfortunately don't have any information to respond to the question about the trauma-informed approaches to promotion, but that especially thinking about points of entry and places where there's going to be these cross-border populations that may be affected, then it's an important question. Unfortunately, can't answer.
All right, so, other questions? So we'll go 1, 2, is there, and 3 over here. And also, if you have ideas, it doesn't just have to be questions, this can also be ideas for who or what is the role of the government, or who is responsible for what is their role within each of these areas around demand creation, particularly around, we haven't talked a lot about regulation and enforcement. I think that that's a really interesting component. Thanks for the question on monitoring, because that filled in a lot of those boxes. So yeah, so it can be comments and or questions again for the panel. So 1, 2, and 3.
Thank you. So mine is a question, but also a confusion.
Don't forget to introduce yourself.
Oh, yeah, I work for UNICEF. Also focusing on washing institutions, washing schools and healthcare facilities. So I just listening to the intervention by Swati.
Yeah.
But also on WaterAid. So for washing schools, for instance, I mean, I was at the time when I saw communities really very actively engaged in terms of contributing to school activities, but also holding governments and schools responsible, accountable for the services they provide to the students of pupils in their schools. So I don't know if you thought about that, you know, as communities, as partners, civil societies around schools, as partners in terms of providing these services, but also in terms of monitoring, you know, the functionality of these services at school. They are really key. I mean, I have seen them, but I know that their responsibility is kind of watered down now because they are looking to the NGOs, the government, and the UN to provide these services. But I think they are a strong force to reckon with within the school system. I don't know if we have education police here, but we have what we call the school management committees, which are formed by communities, but also the school structure. We have the parent associations. Those are very strong structures that can help, you know, to support schools to provide these services, but also to monitor them. You know, I saw them coming to meetings and they would ask headmasters, how much have you allocated to this activity? How much have I allocated here? And how much have you spent? How much do you need? And they will even contribute funds or resources to the school system. So I think these are structures that we need to organize. And I think as we work in these countries, we need to look at these structures and ensure that we are empowering them to speak, to demand accountability, and to get involved in planning, but also implementing, monitoring, and evaluating these services. And I think to your question about, to your contribution about the markets, you talked about the markets and the bags. These are institutions, again, also services that are within the purview of the local governments. In my country, for instance, markets, they have associations, but the bus park, they have associations, and they're usually under the local government. So we have local government at the central level, sub-national level, and the local level. We have parish chiefs, sub-county chiefs, or, you know, county chiefs. These people are responsible for making sure that these people who run parks or who run bus services or who run markets are actually providing these services. They're supposed to make sure that their toilets functioning within these markets or even the bus stations. So we need to recognize this and also work with them to make sure that they actually provide these services and they monitor the functionality and they report to the local government. So I think we need to recognize those local structures because they're really essential in terms of contributing to the provision of the services, but also, you know, making sure that they are functional on the reporting. Yeah.
Great, thanks. Next. Yes, you are.
Hi, I'm Gracie Hornsby, also state biases. I get sort of the Swati, but more on the evaluation side of Wash Up India. And I think something we saw consistently.
Can you speak up just a little bit so
Yes.
everyone can hear you?
Sorry. And something we saw consistently in our formative work was that there are actors within the government that very consistently funnel funds away from either Washington schools or O&M that are intended for that purpose. So I'm curious to hear the panel's thoughts on integration with the government or the role of government when it's been shown that there are actors in certain parts of the system that are kind of opposing these funds making it to the correct location.
Great. And last one. Yes.
Please answer, they can speak.
Yes.
My name is Evelyn, and I work with Washington State University in Kenya. I work in Victoria, in Kenya, and spread in Uganda on Hygiene. And my comment is on the 2 examples that we have. One from our project in Uganda, point of entry that Victoria is talking about, and the marketplaces and other public places about the hand washing stations that seem to lack ownership. I was thinking that in the same environment where the hand washing stations lacks ownership, someone responsible for it, somebody to maintain it, in the same environment, we have toilets that have ownership. We have infrastructure in there that someone owns them. And I was almost getting into the enforcement and regulation that you mentioned. Is it because the toilets are being enforced by public health law? That if the toilet is not functioning, then the market will be closed. The point of entry will not be functioning and it will be maybe decommissioned. Is it the role that you want to bring the government into so that the hand washing stations then are also regulated? They're part of the company to have a functional market, to have a functional point of entry, so that it's also has ownership. That's the Kenya message. Thank you.
Great, thanks. So initial reactions. I don't know, Swati, do you want to start?
Yeah, so I would
Maybe
just-
use the mic.
Okay, yeah. So I agree with you, with highlighting the point that the school management committees are there, which is at the school level. But many times we've seen that the SMCs do not have, that right capacity built in them to monitor it. And ultimately it falls down to the decision of the headmaster, because headmaster is one of the committee member in the school management committee. So I think that's where the role of NGOs and CSOs comes in. We need to empower them and strengthen them and make them aware of their roles and responsibilities, which is there. Because many times it's just in paper, in writing, and actively they're not functional when you go on the ground. So yeah, I think that's where the role of NGOs and CSOs come in strengthening the SMCs and making them empower and recognizing them for the responsibilities and the powers they hold. They actually hold some of the powers of allocating funds and the usage of funds and asking the headmaster, where was this particular fund spent, whether it was spent in WASH or not. So that is there, but to keep up in the ground level, that's important from the monitoring point of view, from the district and the state level as well.
Anything you want to add?
Yeah, I mean, I think just briefly on the question of the funds not getting to where they need to be, on the one hand, it's about aligning the incentives. So what I mentioned about the results-based programs that we're supporting in a number of countries, Kenya, Vietnam are some examples. It requires the district level, the school level, right? Various levels to align on the activities to achieve that result, right? The result is not going to be achieved in a vacuum. So there, you can't have these situations where, and if you do, you're not going to get disbursement where somebody decides, I'm going to use this fund for something else. But I think at the same time, we have to be a little bit empathetic, because we know that these budgets for recurrent expenses at the school healthcare facility are just not sufficient, right? And they're not sufficient for electricity, they're not sufficient for the wash. So a lot of it is just about scarce resources, and there's not a lot that I really think that's like a more structural issue that needs to be addressed. But I think on the other side, perhaps is on the regulation. So many countries, they do have the regulations that a school cannot operate without a functioning water supply or without certain services being in place. Even where those regulations exist, we know that they're not always enforced, but that's one additional mechanism that can be used to ensure that that these funds are not diverted, because they ultimately have to meet the regulatory requirements.
Sorry, do you want to?
Yeah. I just wanted to add on, continuing on that idea of regulation. I think the carrot and stick here is important to think about, because we are asking places like a market manager. Yes, they do. There is an organization, there is a market manager there. They do have a little bit of money that vendors are giving them, but it is a very small amount of money, and hand hygiene is the bottom of their list of priorities. They need to pay for cleaners, they need to pay for other things. But I think acknowledging that right now we're working in a space where we're asking people to voluntarily take this on to their responsibilities for a greater public health good is important, because this is going to be an uphill process of trying to find ways to keep these things sustainable up until there is regulation and some sort of enforcement mechanism. It's just going to be it's going to be slow going.
Great.
Maybe if I can just add one more point, in terms of monitoring at the community level, household level, in terms of usage of so-called handwashing, I just want to say that again, I think I've seen some countries where actually the local chiefs, or I don't know how they are called in different countries, but they are really essential in terms of enforcement, because we have had like chiefs or officials from the Ministry of Health, from a local health facility, or the community health workers who actually monitor and monitor households and make sure that they are using facilities available for hand washing and making sure every household has. So government may not come in, but there's enforcement within the community by the local chiefs, by sanitation, focal points within the community, health workers, and I think those structures need to be empowered. We need to work more with them, because they reach the community, the households. I mean, it's more than the government might want to do it itself. So I think we need to recognize and work with them as well.
Great. So we're getting to the point where we want to kind of bring things to not necessarily to a close. We still have 10 minutes, but to hear kind of some highlights and reflections. And so there are a couple of points that are from the folks online. And so to be as interactive as possible. We didn't get to answer this question, but I think it's an interesting one. So it's a food for thought for the future. That the barriers to setting up clear indicators for hand hygiene in these different settings. We talked a little bit about the barriers in general, but specifically kind of following on the monitoring side, what might be the difficulties in having, kind of common indicators, and maybe that's something that the guidelines is going to recommend. And then there was one comment about, which I think aligns with what was discussed earlier about government's role is also to collaborate and coordinate and work with other sectors like the private sector, like, the NGO communities and things, not only around, they said around behavior change, but also I think around all of the aspects of supply chain and regulation and all of these different aspects that are listed here. So if we could just give our panelists a big, nice round of applause. Thank you guys so much. I'm not going to have you take your seat again, but thanks again. And this is just the beginning, I think, of these really great discussions. So thank you for a lot of the input. And I'm going to turn over for some highlights here to Lisa. Lisa Reg from FCDO. And there we go.
Great. Hi, everyone. So there was so much rich discussion in this session, and I've participated in quite a lot. And I must say that it was really amazing that every time we have another constituency and discuss this in another forum, we get so much more feedback. So that's just really great. So thanks, firstly, for all of that engagement online, and I think in the room as well. Secondly, I just want to say this paper on, looking at how we better integrate hygiene and behavior change, not just for hygiene, just behavior change more generally into the building blocks, is also really important, and I think really helps to bring that discussion forward in terms of how those government responsibilities are allocated, but responsibilities are allocated throughout the whole of the system. So I think that's really interesting. So great discussion. I think firstly, having that diagnostic tool is really important, the HAFT tool and probably other diagnostic tools that we have. But is it, and what I'm getting here is perhaps more important to have the dialogue at different levels, at the community level, in different settings around who's responsible for what. and then making sure that that is captured and established and put into a plan, that it is financed, because that clearly is something that's lacking, but making sure that we have those spaces. And we, I guess, often assume that those spaces exist in the health sector, but actually they probably exist in lots of other parts of the system that we really need to be thinking about. So it was also really interesting to hear this whole question around regulation, around enforcement, who measures what, who makes sure that there is compliance, and when and for how long. And I think there was a lunchtime session around risk, but is it that we just adopt risk-based approach and say, actually, when there is an outbreak, we need the Port Authority to do this, or is it something that needs to be constantly financed? So thinking about what we're actually saying needs to be financed and when that's important. And then I think there's this element around preparedness, and again, we've learned so much through the COVID pandemic, but even before, I remember cholera outbreaks and thinking how we were mapping how those, how that was spreading through a certain country, and actually that bus stations and those kind of points where everyone comes together are really critical. So we've known that for a long time, right? In a way, it's come to light again, but we really need to continue thinking about it, because it's not just COVID, it's also other illnesses that we're seeing at the moment. So I guess what I was trying to say on preparedness was that it's really about institutionalizing these things, and I think that's what this conversation is about, right? And it's not just institutionalizing, it's also about measuring progress. So I welcome that comment online around kind of how do we measure and what are we measuring? Are we measuring progress on behavior change, or are we measuring progress on how the system is including the behavior change components into the responses or the kind of public policies that need to be in place in order for that to happen? So I think that's a really important comment. And the other point around how that needs to be integrated. We don't want to create a new hygiene system, right? It is part of the existing system. So we need to think about what those bits of the system, how they're working better to make sure that we are having that hygiene is kind of a part of WASH, right? We don't want to forget, we've been talking a lot about the WASH system, and talking a lot about hand hygiene separately, and the guidelines will really help to identify that, but we mustn't forget that they have to also draw and make the links with the WASH system. So I don't really want to say very much more, but I think that's been a really useful session. Again, I guess, sorry, because we are an academic audience, or there is an academic audience, I can't put myself into that. But I think really important that that we had the discussions on Monday around measuring progress and measuring kind of systems progress. So what those incremental bits of progress are that show that we're on the right track. So is it, that the Port Authority has a regulatory mechanism? Is it that, there is a link between the local government office and the school, or, the public transportation agency, or all of these things? So I think it's about thinking about what those indicators are in the system and how do we measure that progress, and just again, not to forget that it's part of the broader system. Yeah, thank you very much.
And I'm back just to give a big, huge thank you and to close this out. Thank you to all of the speakers today. I think you really contributed so many insights and experiences that will feed into this process. Thank you to Ellen for facilitating this session for us and being a great moderator. And thank you to you all for your brilliant questions and your inputs. We will be touching base with WHO and UNICEF after this to sort of feed this back to them for the guidelines process. And then we'll also have an event summary up on the Global Hand Washing Partnership website, probably in some weeks from now. But just a final note that this is very much an ongoing process. We hope to continue to host discussions like this, including one at AfricaSon in a couple of weeks, but of course, other conferences and other setting specific workshops. We hope to continue these conversations again as the guidelines progress. So thank you all for joining us today. Yeah.
There we go.
Okay, great. Yeah. Cool. Thanks for this.